Unions have come out to protest what they term as discrimination within the Ministry of Health. They protest a recent promotion of medical doctors, saying other cadres were left out. The unions, which include the Kenya National Union of Nurses, the Kenya Union of Clinical Officers, further reiterated they would declare a nationwide strike on Wednesday in line with the notice issued last Thursday. We are now joined live by the Kenya Union of Nurses Secretary General Seth Panyako on the same. Many thanks for your time on a weekend at 1. Nurses and other medics, of course, are at the front line of the fight against COVID-19. But this ultimatum to the government has left many Kenyans wondering whether nurses are being opportunistic at this time, because Kenyans, the health of Kenyans, should be at the forefront.
It is actually the Ministry of Health that is being opportunistic at this time, because it's using the COVID-19 pandemic to only effect promotion for medical doctors and leaving other 18 cadres out of promotion. We have health workers in the national government that has never been promoted for more than 10 years. We have those health workers who are employed on dubious contract across the county government, and nobody is talking about them. You have a health worker you have employed, you are paying 15,000 shillings, and this is a graduate. And when they try to employ, they discriminate. They are not employing nurses with degrees. They go ahead and employ those with diploma. It means that those nurses who are right now working on dubious contracts, and they are working with their colleagues who have diploma certificates. Those with diploma certificates will be employed in permanent apprenticeship position, and then the degree nurses will continue to work under the contract and earn 25,000, while certificate and diploma nurses, the salary might even be 3 times, maybe 7,000 and above. What the Ministry of Health did, immediately we issued a statement on Thursday that we will be issuing a strike notice next week on Wednesday if the government will not have engaged us. Instead of actually the ministry proceeding and promoting all health workers that are serving within the national government, it proceeded and actually spit in our face by promoting only medical doctors and leaving other health workers out. We are told that frontline health workers, nurses are #1 frontline, followed by clinical officers, medical laboratory, and doctors. But when it comes to money and privileges, they are actually giving the medical doctors alone. When the president said that the two ministries, the Ministry of Public Service and that of the Ministry of Health, to make a welfare package for frontline health workers, up to now we have not received any information from the two ministries asking us what will be our wish in the directive given by the president. We have written letters, no response. They say they're not receiving hard copies. We send through email. No one is responding to our letters. It means that the Ministry of Health is seriously pushing other health workers to go on strike. And for surely, if Wednesday they will not have engaged us, we will have no option but to issue a strike notice.
All right, but this seems like a case of because you did to so and so, you must do to us, because the doctors got promotions, the nurses must get promotions too. But understandably, because nurses really are at the front line of this. The Kenya National Union of Nurses has about 30,000 registered nurses. The numbers of COVID-19 in the country stand at about 353. Medics say we are not in a crisis yet. But talk to us about the reality of health workers, medics and nurses as they fight the COVID-19 pandemic. Many saying even PPEs are a luxury in their hospitals.
We still have the problems that we started with. PPEs are not there. And if we are being told that 40 billion has been used, I don't know what that 40 billion has been used to do, because when you go to health facilities, even you go to Kenyatta, you are being told you have to use one surgical mask for a period of actually 16 hours. And what is required is that you are not supposed to use a mask more than 5 hours. When you go to level 3, level 5, and level 2 health facilities, they do not have masks, leave alone even having protective care complete. When you look at, for example, Vihiga County that was on strike the other day for non-payment of salary of the month of March, they are not prepared at all. When you go to a county like Homa Bay, up to now, health workers and other public servants have not been paid salary. So we are talking, I'm sitting here on behalf of all health workers, apart from the medical doctors, because we have agreed to work together as health workers to champion for the interest of our members. Personal protective equipment are not there. Training for health workers has not taken place. When you come to the issue of we are raising about commuter allowance, it should be doubled, because now we are paying double the normal commuter allowance. It is not being addressed. When we talk about medical life insurance, no one is responding. When you talk about taking care of those frontline health workers and identifying them, those actually who are directly involved in management of these patients and screening them, to be put in a place like a hotel or even hostels, Kenyatta National Hospital, so that during this pandemic, they should not be allowed to go home to socialize with their families because of high risk of infecting them. No one is responding to us. The truth is that the Ministry of Health has given health workers a deaf ear, because as we have said this morning is that the Ministry of Health is actually being manned by one cutter, and that's the medical doctor. So they will only further their own interest. We have looked at the letter of promotion, and if you do not have, I'll be giving to you through WhatsApp. Even Dr. Mwangangi, who is the CAS in the Ministry of Health, has promoted herself. So we're asking ourselves, is she earning two salaries? Because when you have been given the Chief Administrative Secretary position, which is an executive appointment by the President, you are supposed to freeze the other one, so that they give you leave to keep services in the new position. When that leave, when the service you are giving is finished, then you go back on your duty. There is no way you can be promoted when you have been seconded to a different arm of government, and where you are coming from, you are still being promoted. You know, this level of corruption is what we're saying. We want the Ethics and Anti-Corruption Commission to come in. Because we cannot, how should somebody be earning two salaries in this country? How do you promote about 200 doctors and you leave other health workers out? Some of them have been out for, like those who work in blood bank, those who work in Port Health, those in Madare, those in spinal injury, those even in Afya House, those even in all public health facilities which are still under the national government. Right. They have only promoted doctors.
Let me perhaps ask this, because it does pose serious consequences to the nation's healthcare system should nurses go on strike in the wake of this pandemic. But how serious a threat does it pose for the Ministry of Health and other government bodies not to listen to the cry of nurses and medics now? Because we've seen countries with advanced healthcare systems calling out to even retired healthcare workers to come and help in the situation, with many countries being overwhelmed by this system. How bad a consequence are we looking at should your call not be heeded to by the Ministry of Health?
We know the consequences. I've already said that the strike is not about nurses alone. It's about 17 healthcare cutters out of 18. The nurses, clinical officer, medical laboratory, physiotherapist, nutritionist, cleaners, anybody who works in a hospital setup, apart from the doctors, will be going on strike. The consequences, they are far-reaching, but we expect the government to engage us within these 7 days. On Wednesday, we shall now giving official strike notice. What we gave 7 days was to have the government engage us before we issue a strike notice. So if they will not engage us by Wednesday next week, we shall be releasing a strike notice. I do not know how we shall agree with our colleagues. We can issue a strike notice of 7 days, 14 days, or even 21 days. That will be agreed upon by my colleagues, or the caucus that we're working with. Otherwise, we know Zimbabwe health workers went on strike because they did not have personal protective equipment. We also have hospitals in the US where health workers refused working, saying they cannot go in war without weapons. Our weapons is personal protective equipment, and any incentive that's supposed to come away must be equitably distributed along all healthcare workers, especially those we are calling frontline health workers. But we cannot have some people, about 70 doctors working in Afya House, promoting themselves and giving themselves incentives when they are sitting in Afya House. We have said from the beginning that there is no hospital. Afya House is not a hospital. It's not a referral hospital. And that's why we are saying we need to relook this Afya House. What are these over 70 doctors doing in Afya House? So we will go on strike. That I can tell you, we will not be looking back. Our members are charged on the ground because they feel they are being used and they are being neglected. They feel like the government does not really value even their lives.
All right, many thanks. That is Seth Panyako, Secretary General of the Kenya National Union of Nurses, reiterating there that ultimatum by the union, as well as the Kenya Union of Clinical Officers there, saying they are declaring a nationwide strike beginning Wednesday, 4 days from now, should the Ministry of Health not heed to the ultimatum. Let's take a short break here on a Weekend at 1. Do stay with us. My news breaking headlines on the other side.